Hello friends, this is Dr. Naveen Agrawal. I am an intervention cardiologist practicing at Valsad and Vapi district of Gujarat. My topic for today's discussion is regarding non-vegetarian food items which are permissible in a patient who is having a cholesterol related or a coronary artery disease. A lot of people who have already had a heart attack or a brain stroke or a cardiovascular problem which is related to the high amount of blood cholesterol levels, or if at all the patient is already having a high blood cholesterol level without already having a heart attack, what are the dietary precautions which these people can take if at all they want to continue on a non-vegetarian diet? Because majority of the times when the patient comes to us with a heart attack, we tell the patient to switch over to a more of a vegetarian diet. May be practically possible in an Indian scenario where maybe a large majority of the patients are still vegetarian, but in the Western scenario or in people who are staying abroad or people who are staying in countries where large majority of the diet or the staple diet is a non-vegetarian food, then it becomes very difficult for these people to follow or completely change their diet on a long-term basis, because all of us know that dietary precautions do not work if at all we follow them for a very short period of time. They only work when you follow them for a very long or a prolonged period of time. Then only they will start to provide you more and more benefit. Although I don't say that they will dissolve the pre-existing blockages which you already have in your coronary artery, but they will make your life a lot better if at all you switch over to a relatively less fatty food or relatively less food which contains a large amount of cholesterol content in them. More of a vegetarian diet is a relatively better option, but still if at all you do tend to prefer non-vegetarian food items, I would give you some tips which you can follow to make your life a little bit better. This topic is going to be very clinically useful and interesting, so I would request you to see the video till the end. The people who are new to my channel, I would request them to subscribe to my channel, as this gives us a lot of inspiration and motivation to make more videos for you in the future. If at all you have any comments, queries or suggestions for us, and if you want us to make more videos on a specific topic or any patient related queries also you have, you can write to us about them in the comment section, and we would be trying to answer a lot of your queries, and we'll be happy to take up more topics which you feel are more important for us. And if at all we feel that these topics are feasible for us and interesting for us to take, we'll be definitely taking them up. Coming back to the topic, what are the non-vegetarian food items which are permissible in a heart patient or a patient having coronary artery disease? Heart disease or coronary artery disease is a disease which is characterized by increased cholesterol deposition into the blood vessels. The more amount of fatty food which we take, the more is the chances of the cholesterol deposition in the coronary arteries, and over a period of time the blockages in the coronary vessels will keep on increasing the more amount of fats we consume on a day-to-day basis. So it is advisable for all of us to follow dietary precautions on a daily basis and take less and less amount of fatty food. The issues with animal food is that animal food usually contains a large amount of high cholesterol, and the absorption coefficient of this cholesterol is also very high, because this cholesterol gets easily absorbed and assimilated into the blood, and a large majority of this cholesterol might, if at all it is in excess of what is required by the body on a day-to-day basis, it will get deposited into the blood vessel, and over a period of time your blockages will keep on increasing. So people who are consuming non-vegetarian foods on a daily basis, they are at a much higher chances of having coronary artery disease. Non-vegetarian foods except the egg whites and the fishes, because egg whites and the fishes are much more healthier options and they give us a lot of amount of proteins and much lesser amount of fats. But if at all you are taking a much more fatty food which is in the form of mutton, chicken, beef or these sort of foods, these are not usually healthy options, and these will provide you with a larger amount of fat content, and over a period of time your blockages and cholesterol related problems will keep on increasing. So if at all you are consuming a non-vegetarian food, you can take as much amount of fish as you want, and out of the fish also, if at all you are consuming a large amount of it, you should make sure that the fish is boiled or steamed, not fried, because if at all you fry the fish, the advantage is lost and you add more and more oils to this fish, and the benefit which the fish normally would provide to you will be reduced. Out of this fish you can take more amount of fatty fish. People will ask us, fatty fish is also fat, so if at all you are taking more amount of fatty fish, how can that be of any benefit to the people? So if at all you are taking fatty fish, these fats are usually containing more amount of polyunsaturated fatty acids and omega-3 fatty acids, which are usually not deposited in the vessels, and rather they would decrease the blood cholesterol levels to a certain extent. So these are very healthy, and if at all you take it as medicinally also, this fatty fish or the oil from the fish is taken medicinally also, this reduces the blood triglyceride levels, and the HDL levels are improved by this to a certain extent, and the chances of cardiac arrhythmia and sudden cardiac death are also improved if at all we are taking this fish oils. although medicinal fish oils are recommended much more as compared to the fish which comes directly from the fish, but still it will be of some benefit if you are taking fish. If at all you even want to take more amount of fish, or you want to take fish on multiple times in a week or in a month, that is also permissible as long as more amount of oil is not added. As far as eggs are concerned, you should prefer the egg white portion. Egg white you can take as much amount as you want. Egg white usually contains 5 to 6 grams of protein per egg, and if at all you consume maybe 5 or even 10 eggs white also in a day, that will not be of any harm to you. The absorption coefficient value of this egg white is also very high, and the protein is assimilated very easily if at all you are consuming egg whites. That is why in majority of the patient we tend to recommend you to take egg whites, but the yellow portion of the eggs usually should be avoided because that contains a large amount of cholesterol. Although there are some studies and some small studies which do favor these, and they say that the LDL which is formed by this is not of the dense type, and some amount of increased HDL is also seen with this egg yolk portion. But usually in majority of the patient we tend to ask you to avoid taking the yolk portion of the egg, or maximum also if you are taking, you can take it maybe once or twice in 1 week or 1 month. That will be more than sufficient for you, because the cholesterol which is present in the eggs is very difficult for the body to assimilate and get rid of. That is why we usually do not recommend egg yolk. We recommend you to take as much amount of egg white as you want. As regards to mutton chicken is concerned, chicken can be taken, especially the skinless chicken and skinless poultry can be taken, but usually as far as possible the pieces should be avoided. Gravy can be taken, or some spices or non fatty forms of this preparation or less oil containing forms of this preparation can be preferred, but as far as possible you should not exceed more than once or twice in 1 month. Similarly for mutton also and beef also, you should avoid this because these contain much larger amount of cholesterol as compared to chicken. So as far as possible the red meats, beef and the mutton should be avoided by the people as far as possible. You should not consume this more than once or twice in a month, and if at all you are taking the gravy of this, that is acceptable option, but the pieces or the fat containing portion of this animal meat should be avoided as far as possible. Similarly goes for the red meat also. Red meat also contains a large amount of fatty portion, and the absorption of this portion is much better. Although this is nutrient dense and although it increases the hemoglobin of the patient, but overall it provides much less nutrition and much more amount of fat, and over a period of time it will do you much more worse harm, and much more damage to your health might be seen by this food as compared to the advantage which will be given by this food. So as far as possible any of these red meats should be avoided. Animal liver is nutrient dense and less in cholesterol and fat, so that can be considered a good option. Out of all organ meats, liver is the most nutrient dense, and liver contains a large amount of folic acid, iron, chromium, copper, zinc, which improves the hemoglobin level also and keeps the body healthy. So if at all you consume liver of the animal, that is relatively considered more healthy option. But as far as possible, in most of the people who are taking on vegetarian items, I would recommend you to take more of fish, more of egg whites, less of egg yolk, and less of you can take skinless poultry, but should avoid all forms of red meats and all form of fatty meats. And as far as possible, whatever meat preparation you are preparing, you should prepare them with the minimum amount of oil, because large amount of these food products also contain large amount of salts, large amount of spices, and large amount of oil. The preparation of this foodstuff also makes them very bad or much worse for food product as compared to what they naturally would be. So the preparation of this foodstuff is also important. Whenever you are preparing this foodstuff, you can add more of spices but less of salt, less of oil. As far as possible, you can steam it, grill it, but minimum amount of oil should be used. That should be the precaution in these cases. So in this topic, we have discussed what are the non-vegetarian food options which are available in the people who are dealing with or who are suffering from coronary artery disease or cholesterol related cardiovascular problems. As far as possible, if at all you are switching over to a vegetarian diet, that is a good option, but fish and eggs are healthy. Other forms of non-vegetarian food items are usually to be taken as less as possible and should be prepared with as little amount of oil as possible. If at all you have any comments, queries or suggestions regarding to this topic, you can feel free to discuss them in the comment section. If you have any patient related queries also, you can write to us about them in the comment section. At the end, I am Dr. Naveen Agrawal, thanking you all for a very patient listening, and I hope this topic has brought to you some important insights and important information. If at all you still have any comments, queries, you can write to us, and the people who are new to my channel, I would request them to subscribe to my channel, as this will give us a lot of inspiration and motivation to continue the channel in future. Thank you.